Hello guys, so this is going to be part two to one of our previous listener submitted questions. Kind of the highlight of the overall question was, what are some of the difference when kind of raising little toy dogs versus big dogs? Like I said, a lot of different ways to go about it, but we did a video on the toy breed. This is kind of the follow-up for more of the large to giant breed dogs. Okay, so here we go. And on our large breeds, for starters, depending on the veterinarian you talk to, or breeder, or this or that, there is a lot of discrepancies or contraindications. Just depends what side of the fence you're on how you feel and your perspective. So there's a lot of variables just depending on how strongly you feel about this aspect versus that aspect. What's the right answer? I don't know. I think it's a little different for everybody, and every vet has their own comfort and difference depending on training and experience. But there's just, the field in general hasn't 100% agreed. Therefore, there's kind of a divide. So keep that in mind. So kind of like in our first video, we're going to kind of pick up from, they've already been born. They've gotten through that 14-day period of newborns. They're doing good, doing well. You just got your new puppy, about 8 weeks old or so, got the initial shots. We're assuming we're going to finish the normal vaccine and deworming and the normal puppy things. So, cool. For our large breed dogs, there is a lot of marketing BS, is what I call it. And, there's a huge push in kind of the animal, not medicine, because that's a little more on the veterinary side, but animal marketing. And just look at the corporate things. How many pet foods do you see on the shelf now? There used to be 5 main brands. Now there's like 20. And every year, every 6 months, there's a new famous somebody who made their dog food and they're pushing their dog food. Ultimately, it's kind of a money grab at marketing. There's just so much money, and now everybody wants a piece of the money pie, so they're coming up with their thing. So it's part of where grain-free foods came from in general. That's another topic for another day. Like I said, lots of different versions, different topic. So my opinion, I'm a little biased. For the most part, a lot of the dog foods on the ones where you have a Chihuahua or a Dachshund, and hey, this is for my Dachshund. Well, I have a Great Dane. I want to buy the Great Dane dog food because it has a Great Dane on it, or a Shepherd or a Lab or whatever. For the most part, if it's the same company, the vast majority of the nutrients at the micro level are going to be very similar. There are some subtle differences, but for the most part, it's just the difference in the size of the kibble, and that's why it's more palatable to a big dog versus small dog. And just think of that. When you give, a kid, 3-4-year-old kid, a full cheeseburger, they make a big mess and it's harder for them to eat that. But if you have that cheeseburger or grilled cheese sandwich and you cut it into squares, well, the 3-year-old's probably going to go for the smaller squares. The adult is probably going to go for the bigger burger, the bigger full sandwich. So some of it's just age and preference on size of mouth, size of teeth, so on and so forth. So I'm not too big on that. Some are, some aren't. To each their own. So large dogs are a little bit easier as far as maintenance. Probably the biggest thing with clients is don't let them get fat. You should keep that hourglass shape, that Coke bottle shape. If they have lost that by a year of age, you are setting yourself up for failure with arthritis down the road. And the larger they are, they just don't live as long as smaller dogs, smaller breeds, typically. There are exceptions. For the true giant breeds, for most of them, their average life expectancy is anywhere from 9 to 11 years. Smaller breeds, we see a lot of them get around 15 and occasionally break into the 20s. So big difference there. Watch the weight. You'll find problems earlier. You'll start arthritis later. Just everything about is good. Do the best you can with that. For the large and giant breeds, one thing that I do think is important when you're getting to the point of surgery, getting them fixed, the spay or the neuter, for the larger breeds, there's something called a gastropexy. And that is a really good surgery. That's something we do and we recommend in certain breeds, kind of whenever. But what that is our large breeds, giant breeds, deep-chested breeds are more predisposed to something called GDV, gastric dilation volvulus, aka the stomach flips and bloat is the layman's term. There's varying degrees of that. Those are one of the true, legitimate, real emergencies, and time matters. But is it a 100% 360 twist, a 180-degree twist, a 90? Did you get other organ entrapment in there? How long? Those are true emergencies. So when they happen, timing matters. And usually, as long as we can get into surgery within a couple of hours, surgery, not identifying, surgery, from whenever it happens, we can save a lot of patients. But once you get past about that 8-hour mark, a lot of times you're going to have dead tissue, and then it's just a matter of how important was that tissue? Can we do without it? Where? Lots of variables. Don't have enough time in this video. So we do recommend a gastropexy in those large giant breeds because that surgery is to prevent that problem. Basically what we're doing, if you're already under anesthesia, the females were kind of already have their abdomen open. It's nice to just, hey, we're already there. Let's go in and do it. Get as much bang for your buck with the anesthesia as you can, or at least recovery with the cone and the not running, jumping, playing, and all the things that come with it. But basically, a couple different techniques. A highlight version of what we're doing is we're cutting a little bit of the stomach. We're cutting the abdominal wall, the lateral wall on the side of the ribs, internal rectus, and then basically suturing it together in one fashion or another, aka letting it scar together, and then that stomach cannot flip because it's anchored over here, therefore dramatically reducing the risk of a bloat. It's medicine. There's always exceptions with anything and everything, but it dramatically reduces that risk, and one of the true life-threatening emergencies that we do see in those giant breeds. Overweight predisposes them also. With our large giant breeds, something else owners should not do is, I use the pool analogy. Don't go eat your big burgers, all the dessert, the party and everything, and then jump in the pool and go swimming. Don't do that. With these large dogs, you don't want to feed them a lot and then let them rip and run, because then you just put a bunch of food in the stomach and you made it weighted, and now you start swinging it because they're playing ball or chasing a bird or playing fetch. Those are risk factors. So I would reduce that. Just use the general rule of thumb, swimming principles. Wait 20, wait 30 minutes, then go ahead and let them do it. There are exceptions with bloat also. And one, my personal dog, 35 pounds, German short hair pointer, very lean, very fit, running laps at 15, ultimately bloated, and that's a 35-pound dog. That is not a large breed, that is not a giant breed. And she did bloat. So it can happen in any breed, just more large breeds are predisposed. So one of the other controversial things is when to get them fixed. So in vet med, the vast majority of clinics, everything is based on weight. The amount of drugs, the amount of anesthesia, how hard the procedure is or easy, so on and so forth. So just paraphrasing, typically a thin 10-pound dog is easier than a fat 70, 80, 100-pound dog. Obviously, all of them being skinny is easier than fat, overweight patients in surgery, just in general. So there's that. Those are the big things, but like I said, lots of discrepancies in the field for when to get those dogs fixed. Generally, it's more expensive to get a 100-pound dog fixed than a 10-pound dog. Some people believe, hey, if I get them fixed early, it changes the hormones, it stunts their growth. There's different things. There may be validity to it, there may not. I don't have an honest answer for you. So depending on your perspective as the client, what you believe, I think it's a little different answer for everybody. Some are like, nope, I want to get them fixed when everybody else does. We've done giant breeds at 2-3 months, rescues and shelters have, and they still break 100 pounds or so. There's others that are just, yes, they are a Great Dane, but they're a 70-pound Great Dane. They're just not a big Great Dane. Genetics vary, crossbreeds. Others will kind of do it when they're a year and a half. Pros and cons both ways. There's other things with cycles and things like that and predisposing to mammary masses. Different topic for another day. But those are probably some of the bigger things with the large or giant breeds that I get a lot of questions on or we kind of touch on commonly. So hopefully that was helpful for you guys and not too confusing. That one's just a little hard because depending on who you're talking to, there are strong feelings on both sides of the fence. What's the right answer? Depends what you believe. So thanks again, guys. Appreciate your patience and have a good one.